If you live in a remote part of Madhya Pradesh, the distance to the nearest town makes basic medical care a significant challenge. For many, a simple checkup requires a long journey that costs both time and money. To address this, the government uses the Deen Dayal Mobile Health Clinic, originally known as the Jiwan Jyoti Yojana. This program deploys GPS-tracked mobile medical units directly into rural and tribal areas. These vans are staffed with a doctor, nurse, pharmacist, and lab attendant, bringing a primary care team to your doorstep. The goal is for patients to receive a professional consultation, primary lab tests, and essential medicines at zero cost, without ever leaving their community. Before you can access these services, you must have your original Aadhaar card ready. This is a mandatory requirement for identity verification of the site. With your documentation ready and an understanding of the van's schedule, the barrier of living in a remote area is no longer an obstacle to receiving basic medical attention. Your first step is to visit your local Gram Panchayat office. Relying on rumors about the van's arrival is unreliable. Because these units follow a strict route, missing the scheduled window often means waiting weeks for the next visit. To find the correct information, look for the official Deen Dayal schedule posted on the Panchayat's public notice board. You need to note down 3 specific details: the exact date of the visit, the scheduled time window, and the precise location in the village where the van will park. Once you have these verified details, you can plan your visit with confidence. Checking the official schedule at the Gram Panchayat is the only way to ensure you don't miss the mobile clinic's arrival. On the day of the visit, go to the scheduled site where the mobile unit is parked. Look for the official registration desk located just outside the van, rather than following informal crowds. Present your Aadhaar card, or your local ration card, to the staff. They will use this to verify your identity and enter your details into the system. After verification, the staff will issue you an official token. This token determines your turn to see the doctor. During this stage, be alert for unauthorized individuals loitering near the van. All services, including the doctor's visit, the laboratory tests, and the medicine, are completely free of charge. Do not pay anyone for a token number or for fast-track treatment. These are scams. The official process does not involve any private payments. By using only the official token system, you protect yourself from exploitation and ensure you receive the free care the government provides. When your number is called, you will enter the van. Inside, it is equipped as a professional clinical environment for primary care. Your first step is the consultation. You will present your token to the doctor, who will assess your health concerns. If the doctor needs more information to reach a diagnosis, they will refer you to the lab station within the van. The lab attendant can perform basic diagnostic tests on the spot, such as measuring blood pressure or conducting a finger prick test. Finally, if the doctor prescribes medication, take the prescription to the onboard pharmacist to collect your medicine. This sequence allows you to complete a full primary healthcare loop, from diagnosis to treatment, entirely on wheels. Once you have your medication, you have successfully navigated the program and addressed your medical needs. Success depends on 3 steps: following the Panchayat schedule, providing your Aadhaar card for verification, and refusing to pay any private fees. This program ensures that quality primary healthcare and essential medicines are accessible even in areas far from a permanent health center. You can help your community by sharing the van's schedule and these steps with your neighbors and those who may struggle with travel. By following this official process, you can make sure your family and community get the medical care they need right where they live.